Hi, I'm Hannah Schroeder, Senior Customer Success Lead for Healthcare at Realityworks. I'm a registered nurse, certified nurse educator, and certified healthcare simulationist with extensive experience developing and facilitating simulation-based learning to enhance clinical education and workforce readiness. This product is designed specifically for secondary health science and post-secondary healthcare professions programs, so your learners can practice safely, repeatedly, and independently while building habits that prevent infection, protect patients from harm, and prepare them for the expectations of real clinical environments where breaking sterility can have serious consequences. The Sterile Techniques Simulator from Realityworks helps students on their journey to master sterile technique for 3 high-risk procedures: tracheostomy suctioning, central line dressing changes, and urinary catheterization. Smart sensing technology in the boards, gloves, and instruments detects every touch and instantly shows whether students have maintained or broken sterility. This product is designed specifically for secondary health science and post-secondary healthcare professions programs, so your learners can practice safely, repeatedly, and independently. Each Sterile Techniques simulator includes 2 patient boards, a chest board for tracheostomy suctioning and central line dressing changes, and a pelvis board with interchangeable male and female genitalia for male and female urinary catheterization. You also receive 2 pairs of smart sterile gloves, 2 sterile equipment trays, a urinary catheter with drainage bag, swab sticks, a central line swab and dressing, tracheostomy suction catheter and tubing, and towel drapes. A complete 4-lesson curriculum with slides and student materials is available for you to download to help you integrate this tool right into your health science courses. Setup is quick and classroom friendly. Start by inserting 2 AA batteries into the battery compartment of both patient boards. Next, plug the smart gloves and sterile equipment tray into their labeled ports on each board by matching the hand and tray icons. For tracheostomy suctioning, connect the suction catheter to the suction tubing and plug them into the tracheostomy port on the chest board. For urinary catheterization, plug the urinary catheter and drainage bag into the catheter port on the pelvis board and insert the desired genitalia, ensuring it sits flush and secure in the board. In order for that to detect male or female genitalia, you may need to turn the board off and back on again. Turn each patient board on using the power switch, then use the procedure button on the chest board to select either tracheostomy suctioning or central line dressing change. Use the mode button on both boards to select practice mode for real-time feedback or assessment mode when you want learners to complete the full procedure before seeing if their sterile field stayed intact. In both modes, the yellow procedure active light confirms that the simulation is running, and cable lights show connection and procedure status with a green light when all cables are plugged in correctly, a red light if a cord isn't plugged in correctly. In both modes, the yellow procedure active light will turn on and confirm a simulation is running when the silver buttons are pressed with your elbows. For tracheostomy suctioning, students begin with sterile gloves on and the suction catheter prepared in the sterile equipment tray. In practice mode, the board's smart surface senses where the gloves and instruments touch. If students reach beyond the sterile field or handle equipment incorrectly, a beep and a light change immediately, showing that sterility has been broken. When they advance the catheter to the correct depth, the board plays a cough sound, reinforcing proper insertion before they withdraw and suction, allowing repeated, low-risk practice until the correct sequence and hand placement feel natural. During a central line dressing change, learners clean the insertion site. When they've fully covered the site, the board's sensors detect proper cleaning and cable lights turn orange to indicate the central line is clean and ready for dressing application. As students place the film dressing, any stray touch of a gloved hand on non-sterile skin or surfaces is captured and flagged so they can identify exactly when and where sterility was lost and correct their technique. The pelvis board supports both male and female urinary catheterization using interchangeable genitalia inserts, so you can simulate a variety of patient scenarios. Learners perform perineal cleaning with the included swab sticks, then insert the catheter while keeping their hands and equipment within the sterile field sensed by the board. When the catheter is correctly positioned, the cable lights turn orange to indicate urine flow, giving a clear cue that the procedure has been completed successfully, or instantly signaling when contamination occurs. Use practice mode to let students explore on their own with immediate feedback, then switch to assessment mode when you're ready for skills checkoffs that mirror real clinical expectations. The introduced 4-hour curriculum covers sterile technique basics, plus dedicated lessons for central line dressing changes, tracheostomy suctioning, and urinary catheterization, complete with slide presentations and student materials. You can align these activities with national and state health science standards and incorporate them into high school health science, healthcare professions, or pre-licensure nursing lab courses, freeing instructors to coach higher-level critical thinking while the simulator delivers consistent technical feedback. To keep the simulator in top condition, use canned air to remove debris from the patient boards and avoid getting liquids on their surfaces. Disconnect and wipe the sterile equipment trays and accessories with a damp cloth or disinfecting wipes. Machine wash the smart gloves and spot clean genitalia. Make sure everything is completely dry before the next use. These simple steps help your investment last across many cohorts of learners. The Sterile Techniques Simulator transforms sterile technique from a one-time demonstration into a safe, repeatable, and engaging practice experience. Give your students the confidence and skills they need for real-world practice, and give instructors a powerful tool that makes sterile technique visible, measurable, and memorable. Visit Realityworks.com or contact your local account manager today to explore how the Sterile Techniques Simulator can elevate your healthcare professions or nursing programs.